I'm Phyllis Massing, and I'm a member of the Board of Directors of the California Social Welfare Archives. It's my pleasure and my privilege to speak with my friend and colleague, Dr. Frances Caple, about her life in social work. You earned your master's degree in 1971 and a PhD in 1982, both in social work at USC, where we are today. Frances, you and I have been looking forward to this day for a long time, and now we're here. So I'm going to talk about or describe some of your many, many accomplishments. In 1983, you received a Faculty Development Award in Child Mental Health from the National Institute of Mental Health. And from 1983 to 1984, you were a fellow in Child Mental Health at the University of California at Los Angeles, also known as UCLA. You developed and administered the USC School of Social Work state-approved program for the preparation and credentialing of social workers. You presented a workshop at the 1994 NASW National Conference on Engaging Effectively with Culturally Diverse Children and Families, and wrote an article on this topic, which appeared in the 1995 edition of Social Work Education and was subsequently reprinted in Multicultural Issues in Social Work, a publication of the NASW Press. So far, so good?
So far, so good.
Okay. In 1987, you were awarded an Outstanding Faculty Award by Los Amigos de la Humanidad, and list goes on. You were also honored in 1993 with the Koshland Award as the Outstanding Professional Social Work Practitioner in the state of California. You are a member of and have been an officer in numerous professional organizations, and on and on. You are a very busy and involved, have been and you still are, a very busy and involved woman.
Yes.
So let's go back and see a little bit about where it all began.
Okay.
In 1954, you received a Bachelor of Science degree in biology at Benedict College in Columbia, South Carolina, and went from there to New York, came back to Columbia, on to Laurinburg, North Carolina, and in 1958 you landed in Pasadena. So what brought you to Southern California?
Well, isn't that interesting? I hadn't thought much about what brought me to California. Actually, there were several things happening in the East Coast at around that time. I'd finished Benedict College with an idea that I would become a teacher in South Carolina. Though there were somewhat limited goals, somewhat limited knowledge about professions or activities that I might do. And after living 2 years in New York, I got married. And my husband and I talked a lot about California. And I merely said to him one day, I'd like to move to California. And he said, I'll take you. I was stunned because I had no idea that he would actually follow through with that. So we came to California in 1958. 1958. So long ago.
Yes. Where were you, when you were in New York, where were you working?
My first job, this is very interesting. When I think about finishing a bachelor's program with the idea of teaching, went to New York and became a secretary in an adoptions agency. This goes along a little bit with my notion that you never really learn anything that you throw away. Somewhere you use it again. I learned how to type when I was in high school. And I often thought about the major sacrifice that my family made for me to go to college. And here I was in New York working as a secretary. I moved to New York because the year that I finished Benedict in 1954, the governor of the state of South Carolina was Strom Thurmond. And his statement was, if there is any integration of the public schools in South Carolina, I will close them all. So in my youthful thinking, I'm saying, why should I stay here if within a month or two, because the integration of schools was on the way, was coming, if he's going to do something by fiat. So, and besides, New York sounded a lot more exciting than Darlington, South Carolina, which was this rather rural community in which I grew up. So that was why I'd gone to New York in the first place. But my first job was as an adoption secretary, and I've often thought about that in terms of the continuum of my work in social work. I was fascinated with the stories of the families who had come in to apply for adoption, and the process of the home study and the process of placement. It just absolutely fascinated me. Most of the professional social workers at that agency, and as I recall, there were very few, about 4 or 5, but most of them had completed Columbia University. And I often thought, what would it be like to get a Master of Social Work degree from Columbia? But I couldn't afford to think about thoughts like that. So, and there was a lot of other stuff going on in my life. So I married my husband, and we lived for a time in North Carolina, a couple of years, and then we moved to.
And when you came back to North Carolina after New York for a couple of years,
Yes.
And you did teach.
I did. I had been certified to teach in both North Carolina and South Carolina, and we were living there, so I was looking for something productive to do with my life. Went to teach. The teaching was an eye-opener in a way for me, because even though I'd had practice teaching, it wasn't quite the same as being a full-time public school teacher. The children in North Carolina schools, I felt, were extremely in need of attention beyond what the classroom had to offer. And in fact, in my first assignment there, we were really what in California sometimes had been called a visiting teacher. As a teacher of those young people, I was required to make a home visit during the course of the school year. And it was in those times of going in and out of the homes of these young people that I realized this is no environment for that would be conducive for good learning. These were young kids who seemed years behind in their educational development, and I remember sitting in one home where I could literally see through the cracks of the wall outside. And North Carolina had some pretty harsh winters. It would get very, very cold. So I could imagine what it was like living in those homes with very, very few resources. Most of them were farm related. Most of the youngsters that I'm talking about. Now, there was a, quote, city in these rural community towns. But the kids who lived on the farms were often kept out late to work the farm harvest into sometimes October, November. They would begin to come to school instead of starting up in late August as they did in North Carolina. And then they left early to plant. I actually had nightmares thinking about the needs of these young kids that were not being addressed, and there were no resources that I could turn to. It was beyond what my job description said I could do anyway, but I said to myself, this is not a profession that I can pursue. I can't continue to think of working in this environment. So when we moved to California, I did not look for a teaching job because not that I would have expected to see that level of impoverishment here, but it just it no longer appealed to me to teach.
So what job
In
did you
public school.
get when you came to California?
So when I came to California, again, probably looking more to a way of helping to maintain our family, I went to work as a secretary. Back to my old primary skill of knowing how to type and how to take some shorthand. And so for about 5 or 6 years, I think it was, I worked at Bell and Howell Company out in Pasadena as an executive secretary.
And you worked there for quite a while.
I did.
Like 7 years.
About like that.
And then what happened?
Well, we were able to adopt our first child. And I had decided I would become a full-time homemaker. And I did that for 2 years until I realized that I was not cut out to be a full-time homemaker. I really was not the housekeeping kind. I didn't like keeping house. I didn't particularly enjoy being away from the stimulation of the adults in my life. So I went back to work, this time really on excuse me, I'm catching my thoughts about how it came to be that I went to work at the Department of Public Social Services. There had been a strike at about that time, and the social workers in the Department of Public Social Services, or the Children's Services workers, were just beginning to go back to work, and they were recruiting new workers. So I went and I took this test that I passed. It's very interesting because as I think about it, I had no idea what I was about to get into. Not fully, because I had experienced the adoptions workers as a secretary, and from that standpoint, sort of almost an onlooker to the unfolding of those case studies and so forth. But I'd learned a lot more than I think I realized. How to relate to people, how to ask questions, how to help them unfold the story that needed to come.
How did you find this opportunity? Did you go looking for? Were you looking for some kind of social work position? You were looking in the classifieds.
No.
How did you find it?
My next door neighbor, who was herself a social worker, told me about it, and it was really by word of mouth. So I went and applied on that basis. Asked for a spot in Pasadena, which I got. There's a lot of history that, it's interesting how sometimes I don't remember it as sharply as it comes back as I'm thinking about it. But at the time, there were no African American social workers in the Pasadena office. I don't know quite what, but there was a big deal made out of the fact that I had asked for Pasadena, but so I lived in the Pasadena area. And sure enough, I got it, but I was something of an anomaly, I think. I remember my first supervisor there, very, well, how do I say? I didn't want to do investigation, and whenever I would come back with a report of a visit that I made, she was always asking more questions in greater depth about composition of the house, who was there, how long had I stayed, how many children, and so forth and so forth. I was about to leave DPSS at this point when a miraculous thing happened in my life. A man whose name is David Miller, and I'll never ever forget David now, no matter how many names I forget over the years. David Miller had just completed his MSW here at USC, and he became my supervisor. And David was just the absolute best thing could have happened to me in my life. He helped me learn how to relate to clients within the formal structure that the county had established, really, for clients, such that he said to me one day, he said, "You see these manuals on this wall?" And I said, "Yes." He says, "Anything that's in that manual is allowable, and I want you to become familiar with every regulation so that no one can just make you do anything that is not client-oriented." For example, his view about making the home visit was to take a look at the house to see what unmet needs there were. Well, he was beginning to talk down my alley. And it was David who had suggested then that I might really want to consider coming to the School of Social Work for an MSW. And of course I went, "Oh, are you kidding? Who, me?" And he said, "Yes, I think you should do it. You should look into it." And so I began to look into it. And then the rest, as they say, is history. I got here. I was somewhat surprised. I have always been surprised, I think, when good things have happened to me in my life. I don't think that I anticipated that this kind of experience would ever fully become mine. Because when I found social work, I thought, "Oh, this is it. This is the pinnacle. This is it. I found what I wanted to do in life. I could do it."
Okay. You were going to school, I guess you started in 1969?
Yes.
71, and you were still working at the time.
Right. As a matter of fact,
And you had kids. How did you do that?
I
That's a lot to
had,
manage.
yes, you know, I was working. I did not work during the time that I was enrolled in school. I was fortunate to get a county award. They made awards to come to graduate school. And I think they made, I don't know, 6 or 8 a year. I remember going for those interviews. And then again, I was surprised that I get this wonderful award to come and do what I really thought that I wanted to do in the first place. So they gave me a leave of absence, and I had a commitment to go back, of course, to the county for the time that they made this award. But it was a wonderful, wonderful scholarship. I don't know that they give anything like that anymore. You know, a monthly stipend plus the tuition plus books. It was fabulous. And in terms of managing the household, you know, I have and have been fortunate to have a really supportive husband. And I say it like that because he has been so instrumental in my being able to do all the things that I wanted to do in social work. So if I said, "I'm thinking about so-and-such," he would say, "Why not? Do it." So together we did it. So I only had one child at that time.
It was unusual at the time. Not that many women were in school, working, having families. It was not the way it is now. So you were a trendsetter.
Oh,
How about that?
I wasn't thinking about it
A
being a
role model.
trendsetter.
You were a role model, and you still are.
Thank you.
And then you graduated. Well, you did your 2 years back to the county.
To the county.
And then in 1973, you went to work for the school mental health center, psychiatric
Right.
social worker.
Yes.
And how did that come about?
Well,
LAUSD.
yes, LAUSD. I had, in my second year, had a field placement in school social work. Wonderful woman, another name that I'll never forget in my history, Shirley Fennell, who taught me about school social work. She had a very specific perspective about it, and she made sure that I got it. She was wonderful. She would say things, you know, I'd be just, champing at the bit because of something that a teacher said or a principal said, and she would say, "It's good for you. It's good for you." And sure enough, things have worked out to be good for me. So I went back to the county thinking that I would forever be a child welfare worker and a children's services worker in that department. I had no intention of leaving, but they were going through tremendous restructuring at the time, which left me with little opportunity for promotion. I had been number 3 on a promotions list when I came to my second year of graduate study. And then when I got back, I think I was number 359 or something like that. There were things that were beginning to be incongruent with what I was hoping would be my future. Besides, I was thinking, if I go into public schools, I could be off in the summers when my child is off. I could be off at winter break, spring break, and so forth. And so let me try this out. And there was an opportunity at school mental health to become a school social worker, and that's what I did for the next 4 years.
And after that, well, you spent a year at UCLA.
Mm-hmm.
How did that come about?
The UCLA opportunity came actually much later. That was after I had completed the PhD. The 4 years that I spent in school mental health, I was working in children's centers. And the basic principle of that particular assignment was to provide preventive mental health. And I kept asking the question, what is preventive mental health? What is that about? What does that look like? What is that? And it turns out, of course, that what we were doing as we went into these children's centers was meeting with teachers, preschool teachers, and with the parents particularly. And working with them on an early basis is really more like early intervention around the issues that the children may experience as they grew. I enjoyed that a great deal, but then I got thirsty for learning some more. One of the things that I really enjoyed about being in the master's degree program was the opportunity to learn something new. I was just really, really jazzed on that. Excuse the expression, all these old-fashioned words. But that was a fascination of mine, and the idea of going back to school to get a doctorate in social work, I became captivated with it. And so that happened. Again, I thought, okay, I'll take this risk and I'll apply. And I remember I was sitting in an alumni association board meeting one night, and the then dean, Maury Hamovich, came in. He sat next to me, and he said, "The committee said yes." I said, "What committee?" And he said, "The admissions committee for the doctoral program said yes." And my knees buckled, I'm sure. I just could barely understand and believe that I could be seen to be admissible to this program. So here I am. Well, there I was.
There you were, exactly. I'm going to paraphrase this. It's, you wrote that you love this profession, that its basic principles can be applied in so many ways. So when you think back about it, and you've already discussed that first experience in those schools in the Carolinas, mm-hmm. Would you say that was the time, was it later than that you became really enamored with the profession? Because it sounds like the seeds were planted right then, when you were seeing basically how you could not help the kids.
Yes.
And their families anymore doing what you were doing. And I also wonder, was there anything in your family life that might have pointed you in the directions where you were responsive to seeing the needs of families and children?
Mm-hmm. You know, perhaps indeed there were many things that happened in my early life. I grew up in the segregated, prejudiced South, very openly so. I mean, there wasn't any question about that. My grandmother is the person I think that I attribute most to the laying of the foundation, although it certainly was reinforced by my own mother. But I spent a lot of time with my grandmother as I grew up. And her notion of being with people is a piece of what stays with me even today. So if I were to look at it, not even knowing what social work was when I was in college, when I talk about the limitations of even my thinking about what else could you do in life. When I went to college, you would either, as a black Southern person, you would go to work as a teacher, or if your family had some money, you could go to graduate school and become a professional person, a lawyer, a doctor, a dentist. We never thought beyond those kinds of parameters. And I mean, there was no mental health service in my town. There was a welfare department, but it was not a place that you wanted to aspire to ever have to go. And so there were a lot of the basic principles of taking care of neighbors. There was a strong, strong feeling of camaraderie and familial life up and down the block. Everybody knew everybody, and if there was any trouble, we all pitched up. So it sort of started there, and I think perhaps it was indeed that when I went to North Carolina, I was teaching up there, and I saw this impoverishment. I just couldn't imagine it because we were poor. We really were poor. I've made a story a lot about the fact that I was born after the Depression was over, but I don't think that it came down to South Carolina until years after I was growing up and going on, that somehow this condition of stay where you are, just be content with what you have, do with what you have, was kind of ingrained, but aspire for more. My family really did aspire for more for me. They wanted me to go on to college. They wanted me to go on to my mother was so excited when she heard I was going to do the MSW program. But unfortunately, she died just before I was enrolled, but she knew I had applied. Everybody's just so excited. And when I was going to the doctoral program, oh my goodness, there's a tremendous amount of familial support. And so that the notion of looking at and working within the family, and not just my family, but down the block and around the corner and in the church and wherever, was ingrained.
Back to your grandmother for just a moment. You said her way of being with people. How do you describe, could you describe her way of being?
What do I say? My grandmother was just a wonderfully warm, caring, nurturing kind of person. I remember watching her at the funeral of 2 of her children. She actually lost 3 of her 6 children before she died. And she would be the one to greet people at the door and console them. This sort of encapsulates who she was, because she was that way throughout. All of the life that I've known with her was that way. She was just a caring, gentle, wonderful woman. Now, stern when she needed to be. She could be very stern. And she would speak up when she needed to. And it did not matter to her about the segregated system. If she needed to cross the line, she would cross whatever that invisible line was. She would, because she would not allow her children to be mistreated, not outside of the framework that was pretty much established. So that's how I remember her. She was my nurturer. She was my nurturer. In the wintertime, she let me sleep right up under her, so I would stay warm. I can remember how cold it would get down there. But she was my nurturer.
Again, you were lucky.
Yes, I was very lucky. And I remember, I have her memory in my mind so strongly, even after all these years. Yep.
That's a very nice story. We're glad to learn about it. When you first started in social work, let's say what you really did when you were working for the county,
right,
and then back to school to get your master's. What was what were the social and political environment? What was that like then? And what changes have you seen from then to now?
That's a good question, because I was thinking about it a little bit today. The political life, the social life of the country was one of protests in the late 60s. There was the Vietnam War going on, and I remember how badly I felt about the way the men who had fought, particularly men, because at that time those were the veterans, and how they were mistreated coming home because they had fought in the Vietnam War. The protests about the war. Coming to graduate school, there were protests about the affirmative action processes that many schools were undertaking. And I remember the class ahead of mine here at USC, for example, we had 5 black students. The year that I came, they had recruited and had a very, very diverse student body. There must have been about 12 or 14 black students. There were a similar number of Latinos. There was a similar number, I think, of Asians. And there were some reactions to that in the community at large.
What, negative, positive?
Negative. Because that meant that, as a matter of fact, there was a coworker of mine, a white woman, that I felt, she never spoke to me again after we came to school. It was very interesting because I got admitted to school rather early in the year. I knew I was, and it didn't look like she was going to be admitted, but she did. She came. But when she came, I think I had a feeling that she thought that I had come on an affirmative action move. The thing that I really enjoyed about, one of the things, I shouldn't say the thing, but one of the things I really enjoyed about Maury Hamovich, who was dean at the time, was the comment that he made as he talked to us as a student body. And he said, there are many schools around who are beset with protests about affirmative action. He said, but we have felt here at USC that it's much more important to have a representative class of the community that we're going to serve. And so we have recruited from among members of the various communities that we serve. That made such a difference. And we were not operating, we never have operated here at USC on any affirmative action quotas or systems like that. So that was encouraging for me. It made me feel really, I felt that my credentials were in order, but it just affirmed it. I thought it was very important.
I'm thinking of that time. How large was the class?
We had a class of 75, 85. They might have stretched it to like 85.
Very different from
Very different
now.
Very,
And
very
very
different.
different from the time when you retired from USC.
Yes,
In that beginning, starting
Yes.
with the school,
right.
and then starting with your work and the positions you took after that, what were some of the challenges, if there were any? Were there some challenges for you?
In regards to
Your
this
work,
thing,
the people you
work.
work with. You mentioned this the student who
She really
who
didn't
didn't-
speak to me again.
yeah.
That was a very interesting kind of development. I was a little puzzled by it, but then I had to let that go. I have, I think back to my beginnings, and I decided that I must have been brought up with a tremendous amount of trust somewhere way a long time ago in those first years, like we've discussed in, Erickson talked about the beginning of trust, and how during those early years, if your needs are met, if your basic needs are met, then chances are you'll grow up trusting people. Now, that has operated for me to a fault, meaning that there are times when I have been absolutely naive about maybe the reality of a situation because I have preferred to think that what people say and how they behave is accurate. So rather than begin, I never have questioned, never looked askance at someone until it begins to unfold differently. One of the things that I learned about social work practice or interacting with people is looking for the internal consistency. So if it holds, then I would remain just as naive if one sees it as naivete. So there were some times, I think, when I was in the classroom when I wasn't sure if students were wondering about what I might bring to the classroom enterprise. I'm here as your professor, your teacher. Does she know what she's doing? There were times when I had some challenges, there were never major challenges,
Well, you did finish school, you got your MSW.
I did.
And then you went to work.
I did.
For LAUSD.
Yes.
And that sounds like it was the beginning of something you really loved. So
Yes.
Can you talk about that?
My
Not
love.
can you, will you?
Well, I talk about my love for school social work, which really did begin in my second year in the master's program with Shirley Fennell. And Shirley's notion of, meeting the needs of students in schools, the way in which that came together for me after having been a teacher in the public schools, I saw there is a way I can address these needs without having to feel overwhelmed. I knew how to look for resources. I knew how to connect people with resources. I knew how to use the skills that I had developed here to address the needs of these young people. And so I said, this is the practice for me. I loved it. And as I said, I came back for the doctoral program just because I wanted to understand more. I wanted to learn more about this professional practice, and I specifically wanted to learn more about what would be preventive social work, and that you could indeed do it in the schools if you had the opportunity. If the population of the kids, because the population in the schools go from the most adjusted to perhaps those that have the most difficulty and would require some sort of outside help. But so I got the school social work bug. I came back to the doctoral program with the idea that I would study. I just enjoyed being a student now that I think about it, but I knew I couldn't do that for the rest of my life, and I had no idea what I was going to really do when I finished this doctoral program. Where would I look for what kind of job? And an opportunity came up right here at USC. The school social work program, which interestingly enough had been headed up by my former field instructor, Shirley Fennell. Shirley had decided to retire or to leave the university. And they needed to have someone who had a credential heading up the school social work program based on the regulations set out by the state at that time. I'm not sure that it holds today that one has to have the PPS credential, but because I had it, and because I had the PhD at the same time, the faculty entertained the idea of interviewing me for a position here. And so that it was a little bit of a switch from the school's policy at the time, because for the past, I don't know, maybe 10 years or so, they had a policy that said they were not going to hire any of their own graduates in this academic program. And the idea was to bring in new ideas and to infuse the school with more, to become less insular, I suspect, in your thinking, and, we're just revolving through here the same students, the same ideas, the same faculty. But because of the credential, I was able to come on and begin a career here as an assistant professor on the one side and as the director of the school social work program.
There was a period when you were a research assistant.
That was just a little piece that got thrown into my CV. I did some research with one of our faculty here over at the School of Medicine.
What was it?
It was, she was doing a study of interns and something of their development, medical interns as physicians, and their development through the various stages of from being sort of a lay thinker in a way to a medical thinker, and some of the feelings that would be expressed in classroom and in lab. And so I was sitting there observing and marking their observation, their reactions to certain things that might happen. So there was some very interesting observations that were made. And gradually, as the year went by, you saw a lot less, well, I use the expression lay thinking, but let me get it straight, if I can get this clear, how that went. What were some of the behaviors she was observing, particularly some of the personal references that the students would make to the cases they were talking about, to the patients they were talking about, and a movement from that kind of personal relating to a professional kind of relating, looking at the symptomatic behaviors from a medical standpoint as opposed to from a personal standpoint. So one of the things that I had found fascinating, I think, in that study was the fact that there were often illnesses that the interns would acquire just because they would be studying about it. You have these symptoms and these symptoms and these symptoms. Oh, I have that too. Let's see, I wonder if it's my heart. I wonder if it's my blood pressure. I wonder, and a lot of movement away from that. Now, interestingly, when I was here at the School of Social Work, I often saw the same kind of thing. Now, I wonder which one of my family members has this disorder or that disorder, or this diagnosis or that diagnosis, or this assessment or that assessment. So.
Well, it's useful information.
Very much so. Not that you could do anything about it, mind you, but.
So here you are.
Yes.
You were teaching. You were an assistant professor.
Yes.
And you were also a field instructor.
Yes.
So how did that work?
Okay. Being the director of the school social work program, it was important to have some students in schools. And so at that particular time, there were very, very, very few school social work positions. We needed to have field instructors hither and yon. We had a placement or two. I think we had maybe a minimum of 4 students one year, but typically we had about 6 or 8 students in schools. In order to ensure that they had field instruction, I had approached school mental health where I'd worked about the possibility that they would provide field instruction. Well, the school doesn't offer any budget for that. We can't afford to do it. This was back in the early 80s. Actually, Shirley was an appointed faculty member here at the school who did field instruction. So she had headed up the program and done the field instruction. So what school mental health agreed to do was to allow me to have the space and for us to have access to cases. So I took my students to my old job in the school mental health, and we had field instruction. Some really wonderful people have come through that program. That was only the beginning, because in later years, this program has just grown beyond the pale. It's quite a large program, I understand at this point, what with the number of people who are interested, primarily to get the credential perhaps, but I have always felt that this would be excellent training for any family and child-oriented worker. Now, I said that because two things. One was that this wasn't true at all the universities in the state. In some universities in the state, they were very much against persons just taking the school social work program for just to get the credential, that they really wanted them to be going into school social work. There were also child welfare and attendance, child welfare, the child welfare monies that were provided through CalSWA. There were heads of those programs who felt that their students should not go into school social work because they should be preserving themselves to go back to work in the county. My position has always been that because school is such a primary system for the child, next to the family, it's the one system where the child spends more time than any other place, that more than anything, the practitioner working with families and children in that setting needed to really understand how to negotiate for their clients in that system. When I worked at DPSS before I came to school, I remember trying to negotiate on behalf of foster children or for children who were reunited with their parents. And just not knowing who to call and how to talk to them about the school policies and procedures and so forth, in the same way that I was able to do after I had learned in the school social work program. So anyway, on that basis, and because many positions began to open up, this program did grow, almost bigger than at times I felt maybe it should. Partly because the positions really were not there, but that persons would be ready to take a position if a position became available. So there's been a lot of fluctuation in the field. But
I keep thinking back to your year in North Carolina with the homes where you could see through the outside, and that there was nothing you could do to what this program is. Yes, just
a marvelous difference. And I'm praying perhaps and hoping that in North Carolina it's gotten better. I'm just hoping. They do have school social workers in North Carolina. So I know I have some colleagues who are at the University of North Carolina who have written on school social work and who do practice it. So we're there.
That's cool.
We're there, yes.
In 1988, speaking of there,
yes.
In 1988, you came out of the classroom.
I did.
Into administration as the Associate Dean for Academic and Student Affairs. Frances, what brought you there?
Well, here we go again with somewhat not my own thinking. I was never thinking about doing that. At the time, in the evolution of this school, Dean Hamovich, I think he did have, I think Bob Roberts was his associate dean, and but he was headed for the deanship, so that seemed somewhat logical. After Bob Roberts left, Reno Patty came, and June Brown had been his part-time associate dean. We only ever had a part-time associate dean up until that moment. June taught. Before her, Bill Finch was an associate dean. He taught. And I suspect when Bob was the associate dean, he taught. So when Reno came, he was saying, I could use a person who would be there full-time. Would you consider it? And I said, oh, no, I don't want to do that. And he said, well, think about it a day or two. And I came back in a day or two, and he says, I talked to Maury Hamovich, and And then Maury came by and was saying, you know, would you think about it? Would you just think about it? And so I thought about it and I said, okay, I'll try it. I didn't think that I was cut out to do that. But then I loved it. Like I loved everything that I've ever done in social work. Everything that I've ever done in social work, I've loved.
So you did that.
I did that.
And then 4 years later,
4 years later,
you became the Associate Dean
right?
for Student Affairs.
That's-
Was that an evolution of, as part of the process of where you had been for the 4 years, or was it totally out of the blue?
No, let's see, let's get this chronology right. Let's see. In '88, I became the Associate Dean for Academic and Student Affairs.
Mm-hmm.
This was a combination of things. And then, so that I was both,
Right.
actually, come to think of it, I'm sorry. Before I became the full-time Associate Dean, I was doing, I was like a director of student services, student affairs, so that if the Associate Dean got a problem related to a student, they referred them to me. So I was doing that for about a year before I actually went in. June went back to the classroom full-time, and I became the Associate Dean. So there were some evolutionary aspects of this. It was an enormous task, probably much greater than I thought. And as the years went by, it became even more enormous because the student body began to increase. And we had activity up in Ventura one year. We had activity, we had a class that we conducted up there for 2 years. We had a class in Riverside for 2 years. We had our ongoing Orange County program, and then here. And essentially my job was to oversee the master's program so that all curriculum issues, the final approval from the university, all student affairs issues, all kind of funneled through my office. And that's it. It evolved in that way, and I remained in that position until after Dean Flynn came, and you know, she and I were talking, and of course I realized that, at least I felt, that every dean needs to have their own choice of who would be in the Associate Dean's office. And I was here a long time after she came, but eventually I was close to being ready to retire. And so a new Associate Dean, who, well, actually she became a Vice Dean when she came, was being hired. And because she didn't want to do a combination position, well, anybody, well, I would probably not have wanted to either by that time, because our student body really was quite large by then. And when I'm saying quite large, don't ask me how many, because I do not remember numbers very well. But we were several hundreds coming in each year by that time, as opposed to the smaller class early on. So I agreed to stay on after, this was my second retirement. I think I had retired about 3 times from USC. My second retirement, I was about to leave when they said, well, would you stay on until we find somebody to do student affairs? So I evolved back to Associate Dean for Student Affairs. But this was over in the 2000s, I think.
Looks like you were finished pretty much, and maybe retiring for the 3rd time in 2004?
Right,
Is that
finished. I finished in 2004. Finished.
Okay, out of here. And in 2004, I'm reflecting back over those years to when you first began, and you described what it was like then in the external world, and the School of Social Work, which was much smaller then. And then when you retired in 2004, what was the world like? What was the School of Social Work like? What were the changes that you noticed, the most profound changes, both well, you're not negative, so
No.
what were the changes that you noticed?
Thank you for saying that. I was trying to think, what was going on with me? Why was I not negative? I do have, I've always thought of that as a gift. This gift of optimism is just, I can't I can't fight it down. So, but the School of Social Work and social work in general, there were several things that had happened that were different. When I first came into the School of Social Work, there were like 8 schools of social work, I think, in the state. And by the time I was leaving, it feels like there might have been 8 right here in Los Angeles. You know, the schools were beginning to grow, and I'm wondering how big is this field going to get, and it's wonderful, wonderful thought. I can't recall just offhand what was going on when I left. Maybe because I had begun to disconnect, I don't know, from the bigger picture, so to speak.
Which was a bigger picture.
It was a much
ways.
bigger picture.
You
many,
did
many
mention
ways.
that the School of Social Work program had gotten very large.
Very large.
The School of Social Work had gotten very large,
Right.
and larger still now.
Yes.
And
I'm
I'm not going to push you on that.
No, but I think that if I were to make an observation about the biggest changes that I've seen since I left, sure enough, it has been the growth of online programs, not only here at USC, but in other schools as well, but especially here, in many, many ways. And I think I've spoken to the dean about my being old school, in the sense of not quite sure how social work education was going to happen in the framework that it's happening today. I could see the positive aspects of someone living in Pocatello, well, maybe not Pocatello, but living in Darlington, South Carolina, not near university, not able to go to university, not able to get away, but being able to access a graduate education that would be a quality graduate education. I just have not looked into what the online program actually is like, so I don't feel qualified to speak to that. But I could see some pluses, notwithstanding my initial thoughts. Oh my goodness, not going to see the faculty members straight face to face, not even for practice class, you know. But to see how the technology has advanced, it's tremendous. I tend to be much of a dinosaur in technology. I still don't do the computer too well, but I well enough to get emails and process some words. So it
So
works.
you still have questions about how these things are going to work out in the long run, the programs, the online programs.
I must say that I honestly have not collected any kind of data on that, so I have no idea how to think about it. So that it just comes out of an old framework. It's sort of like, how will you process words and it's not on a Remington non-electric typewriter? What do you mean? You can input data and get stuff out? Because my first typing was on an old Remington desktop, original desktop, and then I had a portable one I used to carry around with me. So.
Stop for just 1 second.
So 2004, you retired.
I did.
And the years between 2004 and 2010, you've had time to maybe sit back a little bit, relax
Yes.
a little bit.
Teeny bit.
Hard to see you relaxing, but, or sitting back,
Yes.
and be with
A
family
little bit.
and grandchildren
Yes.
and twin grandchildren
Yes.
and do volunteer
Right.
work.
Yes, I did.
And then somehow in 2010, there you are, back at work.
Back at work. And it's interesting because when people hear me say what it is that I went back to work at, you did? You know? I mean, it's like you don't progress to be the associate dean of the School of Social Work at SC, and then you're going to be a mental health specialist in a CalWorks agency? Do they still do that program? So I have a lot of questions that have come at me. Actually, what happened, and this was, again, not supposed to have happened this way. My sister is a social worker. She came through this program just before I left USC, before I retired. And so she was working at an agency, and she was talking to me one night on the telephone. She said, you know, we're just having the hardest time getting someone to come in on a part-time basis to do some work, some mental health work. And I said, oh, really? What's happening? So she told me about it, and I said, oh, I think I could do that. She says, you serious? So this was the deal. I was supposed to go part-time from March until the end of the fiscal year, which was June 30. So I thought, oh, sure, I could do that. I mean, you know, it won't interrupt too much my life. I had indeed spent a lot of time with my daughter, who had problem pregnancy. So I was at home, sort of helping her out with hither and yon. And but so in order to do this little part-time work, I had to give up one of my volunteer assignments on a committee in the community. And so I went to work in this agency doing direct mental health practice, which I found absolutely fascinating because I had never practiced in exactly that way before. Even though I had been licensed when I was in school mental health, most of my work, as I say, was with parents and with teachers. You did not do therapy in the schools. So there was no therapy per se. So here I am doing a so-called 50-minute hour. It was so fascinating to me that everything I had ever learned in social work just came right back. It was just like yesterday. And so there I was enjoying very much doing this work with women who were indicating they were interested, and mostly women, because these were with parents. It could, occasionally I had a father, who, because of mental health barriers, some sort of barrier to their ability to maintain a job, were coming to our agency for services. They were referred by DPSS to our agency, and they came there for mental health services. So I did that for a couple of months, and I'm getting ready, packing up, getting ready to retire yet another time from another place. And during the retirement party, my supervisor said, could I see you a minute in my office? She said, would you be willing to stay a little longer? I said, how much is a little longer? She says, well, I don't know, a month or 2 or 3. So I said, well, okay, I don't really have much else to do. I was only doing, it was supposed to be 2.5 days a week, but what I did was 3 days 1 week, 2 days 1 week, 3 days 1 week, 2 days 1 week. And so I did. I stayed on. She made me now no longer a temporary part-time, but permanent part-time. So I stayed on that until funding got a little odd. And actually, the funding for the CalWorks program was being cut. Sometimes I talk in shortcut, like funding got odd. Actually, it got cut. So she said, well, our time for this program is up, so I'm getting ready to retire again. When she says, you know, the director of the program would really like to have a chance to talk to you about possibility of you staying on and doing some work with our license eligible practitioners, the ASWs. They come right out of the MSW program. There's the registration with the Board of Behavioral Sciences for the associate social work permit. You couldn't call it a license, but it's the pre-licensing phase. Would I do the clinical supervision? I've never done anything like that. What do you mean? How would I do that? Then I started looking into it. I went online and I looked and I thought, oh, this is back to teaching. So there I am. In the meantime, we were also interested to have interns, and so we had a couple of spots where there were no eligible social workers to do field instruction. So not only did I coordinate the placement from here, but I did direct field instruction with a couple of wonderful students and
From here.
from here. And then last year I had another student, so, but I think I'm going to retire again, maybe this year. This is 2014, but don't mark it in your book.
No.
I don't retire.
However, it's been recorded.
Oh, don't mark it in the book. I will probably, the clinical supervision is really a very interesting developmental process. I love doing that. See, I told you there's nothing in social work that I have not absolutely loved. And so here we have post-MSW persons on the way to licensure, and I can actually see the developmental process at this point in a way that obviously back in '82 when I got my doctorate I had no way of seeing. But it's wonderful. It's just wonderful. They're so exciting. It is so exciting for me to observe these young people growing, stretching the way they are.
Frances, if you do retire, or that would be about the 6th time, I guess, 5th or 6th time.
Yes.
Soon, or next year.
Yes.
Then what?
Let's see. I used to say when I retired the first time back in 2004 that I was literally going to go lay out under a tree in my backyard and let the tree leaves fall on me and whatever bugs were there, they could come as long as they didn't bite, and share my space, and that I was going to do that. But I have 4 active grandchildren who are all under 11 at this point, 11 down to 7. And they're always doing something. And it's, Grandma, can you come over? Can you come to school to see this? Can you see this parade? I'm doing this, I'm doing, and I love that too. That is all, that, in fact, more than anything, that has been just the highlight of my last 11 years. I remember bringing my first baby here, my first grandbaby here, and sharing him with the staff upstairs. It was a wonderful day. And so I'll keep bringing them down and introducing them around and stuff like that. I have a young man whom I mentor who lives up in a foster home in Lancaster, and that will also occupy a little bit of my time. I have to spend some time with him.
How did that happen?
Aha! Well, I was a member of the board at 5 Acres, residential facility in Pasadena, and they had a presentation one day because I am an adopting parent. They needed people who had that experience to mentor families and or children who were on the adoption track or who were adopting children. So my first assignment was with a family that was adopting, and then the worker who was in charge of my placement said, would you consider working with a little boy? So for the past 5 years I've worked with this young man, and Fred has gotten involved as well. Fred is my husband, has gotten involved as well. So we spend some time mentoring him, and this is a wonderful life. It's a wonderful life. And, you know, even though I don't think too much on the macro level, I do think on the macro level, but I am very much concerned on one person at a time, whatever I am personally able to touch. And I feel like I can touch him and my grandchildren, and I do.
Is there anything you would like to say for future social workers who will be watching this? Any advice you'd like to give them?
I think that it's important to have a passion about what you do, and that if you study this profession and you don't find the immediate passion, there is no job that I've had in social work that I did not use the basic skills that I acquired in this curriculum, in my master's curriculum. And so when I was classroom faculty, I could see it operate. Certainly when I was the associate dean, I saw it operate every single day. The whole notion of making a good assessment, finding the right resource, doing the intervention, and then evaluating how effective it has been. It's just, it works in every aspect of the life. So that sometimes I think people come and they study and then they get jaded on what they're doing. Keep looking. There's so many. I've told many young people who were thinking about social work, there literally isn't anything I could think of that you could do that you could not apply social work principles and skills to. So, not to worry. It's all good. It's all good.
This has been all good, and on behalf of everyone whose life you have touched, thank you.
Well, thank you, Phyllis. Thank you so much.